In this video, we're going to go over some techniques that you can do to try to reduce your knee pain that you're having from arthritis. Now, research has shown that by strengthening all the structures around the knee, we can take some of that load and pressure off of the knee joint and thus increasing your mobility, range of motion, and reducing your pain. The first exercise we're going to do is going to be quad sets, and that's going to be where we tighten up and contract our thigh muscle, pressing the back of our knee down into this rolled up towel. So I'm just going to put that behind my knee, and what I'm going to do is really focus on tightening up my quad, straightening and flattening out my knee, pulling my toes and foot back up to me. And I'm going to hold that for around 10 to 15 seconds if I can. Initially, you may only be able to hold that for 3 to 5 seconds. I'm going to repeat this for 5 to 10 repetitions. So I'm going to tighten up my thigh, flatten that out, pushing that towel down into the mat, pull my foot back up to me, hold that. Again, I'm just as long as I can, I'm working towards 10 to 15 seconds each repetition. Then I relax, and then I tighten that back up, flatten that out, foot back, and then relax again. And I'd repeat that 1 to 2 times a day as my pain tolerance allows. This exercise is going to be called short arc quads. So what you're going to do is put a pillow behind your back. You can do this on your couch at home or on the bed, just wherever you can kind of prop up. And then I have this bolster behind my knees. You can use pillows. I've had patients use blankets. You can use any of those things. Put that behind the knees. And what I'm going to do is focus on kicking my foot out, flattening out my knee here, really tightening up my thigh, and then bringing it back down. So you see there's not much movement that's occurring from the bottom of my heel off of the mat. And I'm just tightening that up and bringing that back down. Now, to make this more difficult, as you feel more comfortable, you can add a leg weight to this. I usually tell patients to start with a 2-pound leg weight, maybe 3 pounds. You're going to start with that and try to complete 2 to 3 sets of 10 to 15 repetitions. This exercise is going to be a seated knee extension. So I have a leg weight attached down here in my lower leg, and so what you're going to do is just sit here, kick out my foot, tighten up my thigh, straighten out this knee, pull my foot back to me. So that's the key with that. I like that when you pull the foot back up. I feel like I just get a better quad contraction when I do that. So I have all my patients do it that way and then come right back down. And you're going to repeat this for 2 to 3 sets of 10 to 15 repetitions. Now keep in mind, initially, you don't have to use a leg weight when you start this. Just focus on tightening up the thigh, getting everything nice and straight, pulling that foot back. You may not be able to straighten out the knee all the way. With arthritis, a lot of times, a lot of patients can't go all the way out straight, and that's perfectly fine. Just go as far as you can, pull that foot back, tighten up that thigh, hold it maybe 2-3 seconds, and then go right back down. This exercise is standing hamstring curls, and so I have the leg weight on still. You don't have to use a leg weight initially. You're going to hold on to something that's nice and stable, and then you're going to bend your knee so that you bring your foot back like this. Now, a lot of people mess this up with just going into hip flexion, and that's not a bad exercise, but that's not the purpose of this exercise. A little different. So you want to make sure that we keep the knee back, and we kick back like that. And then back, really tightening up that hamstring and feeling that contract back there and back down. And you're going to repeat that for 2 to 3 sets for 10 to 15 repetitions. This exercise is going to be standing calf raises. So you want to hold on to a stable surface. I'm going to get my feet where I feel nice and comfortable. I'm going to go up on my tiptoes. I'm going to hold that, really tighten up my calves. I'm also tightening up my thighs when I do that. So just to kind of keep everything nice and stable, hold it 2-3 seconds and then come back down. Go up on my tiptoes, tighten up my thighs, keep my knee as straight as I can, tighten up the calves, 2-3 seconds, and come back down. And I repeat that for 2 to 3 sets of 10 to 15 repetitions. These are standing mini squats where you hold on to the back of a chair. Now you can progress this exercise to other types of squats, but initially just for stability purposes, especially if you're having a lot of knee pain, I encourage you to use a chair or a stable surface, a countertop, something that you can hold on to in case you get a little lower than you expected and you need some help coming back up. So all that I'm going to do is put my feet where they feel nice and comfortable. That can be shoulder width, wider, doesn't really matter to me. And then you're going to hold on the back of the chair. You're going to focus on hinging the hip back. So you push back, bend the knees a little bit, and come right back up. So push back, bend the knees, and right back up. A lot of times people with a poor hip hinge pattern will just bend the knees and go straight down. We don't want that because I don't want the knees traveling too far forwards because it may irritate the knee joints. Now, there's a lot of debate on that, whether that does or doesn't. With my patients, it does seem like it irritates the knees more if the knees travel forwards. Not to mention that's just really a poor hip hinge pattern. So I like to encourage them to push back with their hips a little bit and then bend the knees just like that. We're going to go down just a little bit and come back up. And you repeat that for 2 to 3 sets of 10 to 15 repetitions. The last thing we're going to do is work on hamstring and calf stretches. And so what you're going to do is take a towel. You can kind of roll it up like this. Some people will use a sheet. I've had patients use a piece of rope, just whatever that you can use to try to stretch this area. They also make stretch out straps for this as well. So I'm just going to hook this under the ball of my foot. And then I'm just going to pull back. So I've got my knee as flat as I can here. I feel that stretch on the back side here of my leg, and just really just holding this. How hard do you pull? Just whatever is comfortable. I mean, you don't have to get super aggressive with it. Just a little pull there. I'm going to hold that maybe 15 seconds, work up to 30 seconds. Just hold it, relax, and then come back, pull that again, and then just hold that and then relax. If you don't have a towel or something that you can use to stretch like that, you can just prop your foot, on a surface, an ottoman or a footstool or something, just to apply that stretch and lean forwards a little bit. And as you lean forwards, you're going to feel that stretch and pull on the back side here. So again, that is a hamstring and calf stretch. Thanks for watching this video. I hope it helps improve your range of motion, your pain, and your strength that you're having as a result of arthritic knees. Thanks for watching.